Thank you all for joining us today for the first Ask Mathematica Anything, today about human-centered design and public policy and public program improvement. I think the best framework, or the framework that I bring to thinking about human-centered design, is it's a problem-solving technique. It's a way of finding solutions to what a designer would call a wicked problem, which you can think of a wicked problem as one that doesn't necessarily have a right answer, that is not quantitative, that has many people involved, many people affected by it, high levels of uncertainty, high levels of ambiguity, the kinds of problems or questions that are really tough to find answers to, and that there may in fact be no one right answer. And really design is, as a discipline, is somewhat opposed to the conceptual framework of finding the answer. That's one of the mindsets of design that I think is really critical. So you'll see there on the intro slide my name and my email address. If you have to leave early, or you just have questions after the event, or you want to continue the conversation, please don't hesitate to reach out to me directly via that email address. Let me continue. We are getting some questions in the queue, but they're a little specific. So before I turn to them, I want to just spend another minute or two with some background on human-centered design and how I think about it. So I talked about it as a problem-solving method, as a way of finding solutions to really tough problems that are inherently chaotic, inherently dynamic, and involve many stakeholders. I think it can be useful to draw a contrast to other types of approaches to solving problems. Human-centered design is really a great approach to, like I said, solving a problem. And I want to put that in opposition to an approach that looks to answer a question. Now, there's overlap between those two things, but they are fundamentally different. A problem is inherently action-based, that in a design framework, it's something you want to do, not just find something out. And designers often talk about having a bias towards action. We like to try things. We like to do things and use that method of gathering evidence, tweak, retry, go back out into the field in front of our citizens that we serve and other stakeholders, as opposed to a model where the truth is out there and we are trying to get to it. Now, there are some questions that do have a truthful answer, and there is one right answer, and those are generally not great examples of a problem that needs to be addressed using design. But I think one of the most useful frameworks for understanding when design is right is that last one there on screen. If the people you're working with are the ones who decide whether or not you were successful, then there's a really good chance that you're in a landscape where design can be useful. As opposed to if you're doing, say, data analysis, which has a right answer, and it's a matter of finding it, and how people react to that answer has no bearing on whether you were successful or not. So getting a question here that asks, what is an example of a wicked question that you would answer? This is very timely. So this question is basically asking, what are the types of problems that design is well set up to solve? So let me give a couple of examples from work that we have done. So a lot of our work in human-centered design at Mathematica has been in health quality measurement, and I'm a healthcare designer. So a lot of my examples are going to be from the healthcare sphere. I do have others, and I'll try to broaden. If you want to push me in a particular direction to a particular discipline, please just do that in the Q&A. But a lot of our work at Mathematica using human-centered design has been around measuring the quality of healthcare that providers give to patients. So, which is, very difficult, very complex to measure, and it has a lot of dimensions. Now, the way in which you measure performance of healthcare providers is through what's called a quality measure, something that tells you how well on a scale a provider is, how good the care they're giving is. And some of these might be very simple. For example, if you're comparing the performance of hospitals, one very simple way to look at it would be to say how many, when they have a patient who has surgery, how many of them have an unplanned admission within 30 days? You have more unplanned admissions, that's evidence that the care that hospital is providing is not as good as other facilities. So one area we worked at was looking at the folks who work at hospitals who go through medical records to determine how well the hospital is performing, depending on whether they followed certain protocols, which is can be very, very complex in certain cases. And for some complex quality measures may take 45 minutes or an hour just to do one case. And so the people who do this work, it's very challenging, and they were submitting a lot of questions to our help desk. So we went in to we wanted to understand their experience so we could help them do better. This is an example of a wicked question. How are we going to improve their job performance, their experience of their work? And one of the things we kind of went into it with the mindset of, well, they just need to understand their job better. So the technical specifications, we just need to give more detail about the technical specifications. What we learned is that they don't see their job as simply following a checklist of technical specifications and going through the medical records in a mechanical way. Although to some extent that is what they do, that's not how they conceive of their job. They see themselves as key players within a much broader quality improvement system at their facilities that's working to make their system better. So they see themselves as not just touching medical records, but touching patients, touching nurses, touching doctors, touching hospital administrators, touching the entities like insurance companies that are measuring their performance. And so we needed to engage with them on that level of their mindset of where they were to help provide them with resources that could help them do more. Now that's a little complex. Maybe I can give just one more quick example of a wicked problem that is a little easier to digest. So it's become very clear through the last decade or two of research that in, say, a Medicaid system, that there's a very small number of patients, often called beneficiaries with complex needs or super utilizers, but a very small percentage of patients, maybe 5%, who drive most of the care because their conditions are so complex, their socioeconomic status is so complex and challenging, they find themselves in emergency rooms all the time, and it's just kind of one crisis after another. So there's a lot of effort in healthcare right now to find ways to develop programs that help that population, help them get better care, less expensive, keeps them out of emergency rooms. Now that's the kind of problem. Developing a program to help that population is a problem. And there's no easy answer for that. There's no data set you could analyze. It's likely to be very different from community to community that have different systems of care, different healthcare systems, different other kinds of social support systems that affect the care these folks receive. So that's a ripe problem, developing a program to serve those beneficiaries with complex needs. That's a classic example of a wicked problem. I have a question in here about diversity, equity, and inclusion. I definitely want to come back to that, but I think there are some follow-ups here. would love to hear some examples of HCD in public health. Yeah, that's a really good question. And there was a really good podcast last year by some Harvard Public Health School of Public Health professors about how they've incorporated design into their teaching, their research, and their work out in the field, and what the connections are between public health, which, if you're studying, say, epidemiology, is very quantitative. It's people focused in the sense that the data is about people, but often what you're doing is crunching large amounts of data. So this podcast is about the connection between that kind of work and the kind of design activities I'm talking about. I don't have that link at hand, but if you email me after the fact, I'll be happy to provide it. I think there's some interest in connecting human-centered design in the context of COVID right now. We're doing some work at Mathematica, and I'm giving a talk to the District of Columbia Public School, Washington, D.C. Public Schools week after next, about using design to create solutions that serve students and serve families and serve teachers in the midst of what is, an almost unbelievably challenging problem of school reopening right now. That's a great example of a wicked problem. It's somewhat public healthy, and a lot of public health efforts are about education, crafting messages for different populations, say, pregnant teen mothers, maybe encouraging them to stop smoking. That's kind of a classic public health intervention that might be created. And that's a design problem because, most of those mothers, or many of them at least, know that they shouldn't be smoking. It's not a matter of the knowledge. So just putting the knowledge out there is not going to be enough. So then you take the next step and ask yourself, well, what kinds of interventions would work for them? That becomes an inherently human-centered problem. And a human-centered design approach would be to conduct some what are called guided narrative interviews with pregnant mothers who smoke, get them to engage in storytelling with you about their lives so that you can foster empathy for them and really understand their mindset, how they're viewing their pregnancy, how they view the experience of smoking, plus all the other stuff in their lives, which can be quite complex. But also there are many other stakeholders related to that problem, their families, their healthcare providers, the people who sell cigarettes. All those people are good opportunities to engage in data collection from, and that's really the first step of a design process, is to engage in kind of one-to-one or one to a small group data collection, and to go broad. It's really important in a design process to make sure you're asking the right question. So if in the example of trying to reduce smoking among pregnant women, the question I think is not like, why are they smoking, or how do we get them to stop smoking? But it's, you want to understand their experience of pregnancy, their experience of smoking, through engaging them in that storytelling process. And that will give you the raw data to help understand their experience, frame the problem correctly. And from there, you're in a much better position to jump off and create interventions to test with them, to tweak, refine, and learn. But because it's based on that really personal understanding of their experience, I think you really increase the opportunities to be successful. And I'm seeing a link here about the podcast I mentioned, which, yes, that is the podcast I mentioned. Brian, if you want to send that link out to all participants, I think that's a great example. follow-up question about measuring hospital performance. Who initiated the study or the work? Was the study driven by the facilities, the government, insurance companies? In our case, it was driven by the government. Most of Mathematica's work, although not all, is for government entities of various types. But it's the kind of activity that could very easily be undertaken by a hospital facility as well. Let me try to provide a little more detail about some of the stuff I've been talking about. I'm going to move quickly past these slides. Maybe this will provide a little more context. You know, some of you have familiarity with human-centered design, HCD. You know, you may be familiar with some of the methods on screen here, that this is what folks often focus on in human-centered design. And I'm not really going to linger on any of these unless folks have specific questions about them. But there is like a strong methodological component to human-centered design. And I often draw a distinction between being human-centered, and there are many ways to be human-centered, and doing human-centered design, which, as I said, is a technical discipline, a defined methodology. And that's not to say it's superior, but it's just to say when I'm using that term, I mean something technical, and often that refers to these methods and a whole suite of others that are out there as well. And the methods are very important because they're ways of doing the things that I was talking about before, of engaging with people authentically, of learning about their experience to empathize with them and to find problems with them, create solutions with them, test those solutions with them. The methods are what help you do that. So they're very, very important. Those methods exist within a process, and there are many models of human-centered design out there. I'm showing a couple of them on screen here. I think the one at the upper right is IDEO's 5-stage model. The one in the middle is the 4 whats method, what is, what if, what wows, and what works, of that's taught by Gene Liedtke at the University of Virginia Design School. The one at the bottom left is kind of a very famous design icon called the double diamond. And these processes are really, really important as well. One of the things that attracted me to design when I first started learning about it was that it gives you like footholds and handholds to attack a really difficult problem. It kind of tells you what to do first, not in a mechanical way, but in a conceptual way, so that you can, just know where to start. And a design process, and all of these do this, whatever your model is, they all keep you from jumping to the end. One of the real challenges of design is it forces you to look at yourself not as the expert, but as the facilitator of expertise that exists out in the communities that you serve, and to provide them with a structure that allows their expertise to come out and create the solutions with you that will really, really serve them. So this process in which the methods exist is also extremely important and valuable. But I think by far, to me, the most valuable part of design is that it's really a philosophy and a mindset and kind of a way of looking at the world that I at least, when I've been exposed to it over the last 4 years or so, has really been transformative to the way I look at my work and many aspects of my life. And I'm going to try to present this philosophy on one slide. It's not exactly Aristotle. But this is as a couple of questions that if you are in the habit of asking yourself as you go about your work and go about creating solutions for the people you serve, I think you're doing design. The methods, the process are kind of many ways to skin the cat, but it's this philosophy that is really at the core to me. And the first one is to ask yourself, whether you're working on a public health problem or any other kind of social problem, do I understand my stakeholders' needs and problems based on direct evidence from them and not just my own beliefs? So in the example of developing a public health intervention to steer pregnant mothers away from smoking, you may go into that with ideas, perhaps even backed up by research, about how that community experiences pregnancy and experiences smoking. But that's no substitute for engaging with them directly and authentically, and developing an understanding in the context of the problem you're trying to solve that will help you work with them to generate solutions. So that's the first. I think of these as like cognitive reflexes. This is one of the most important questions to ask yourself in a human-centered design philosophy. Another is about framing and reframing the problem in the most productive, human-centered way possible. So to put a finer point on that, there's been a lot of design activity about making the entry process into public programs smoother, more seamless, creating public service portals where people can have like a one-stop shop to apply for, Medicaid or temporary assistance for needy families or food stamps. That's been a major focus of work, and that where design has played a major role. And one of the things that people often find is that or one of the first thoughts they have in these kind of design processes is the application is too long. So the problem is the application for food stamps or whatever service, workforce services, the application is too long. Well, notice by framing the problem that way, it comes with the solution attached. The solution is to shorten the application. Whereas if you frame the problem to start with applicants feel overwhelmed by the process, that opens up a whole world of potential solutions that may serve citizens better than by just shortening the application. And I'm going to connect that to a question that came up. One of the previous slides had jobs to be done, or job to be done as an HCD method, and there's a question in that about the queue. Job to be done is a method for reframing a problem. And it works by asking yourself, within the domain in which you're working, what job is this stakeholder trying to accomplish? And that job, oftentimes folks break that into a functional job and an emotional job. So in the example of an application, what job are applicants to receive public services trying to accomplish? Well, one job is they're trying to get the services. They're trying to get workforce training, or they're trying to get food stamps so that they can eat. And that's important to remember, because that keeps you focused on the end goal, which is connecting them with benefits. But they may have other non-functional jobs to be done within that process as well that can help you reframe the problem in a way that opens up a world of solutions. So for example, applicants to public services often feel ashamed or denigrated or degraded or humiliated by the process that they have to go to, which can be very intrusive if it's a needs-based program in understanding their life. So one job they might have in that context is to go through it with their dignity intact. That's a non-functional job, but it's highly relevant if you're creating a program that is trying to support them through this. I'm going to run through the rest of these questions real quickly, because there's a couple more questions in the queue. And these questions kind of follow broadly the stages of a human-centered design lifecycle. Have I reframed the problem in the most productive human-centered way possible? Am I working directly with my stakeholders to co-create potential solutions? And there's books of methods written about how to do that, which can be challenging in very technical contexts. And then rather than jumping to a solution and implementing it full scale and then getting feedback, have I developed creative ways to test prototypes of those solutions with those users, with those citizens, with those stakeholders in a rapid, cheap, quick way so that I can continue incorporating their input as the solution is being built? I think if you're asking yourself these questions at each stage of a process, you're engaging in human-centered design. I don't want to lose track of the diversity, equity, and inclusion question, and there's another one about community-based participatory research that connects to this. But I want to hit this one real quick before turning to that. What is the relationship between human-centered design and design thinking? Is HCD a more specific facet of design thinking, or are they distinct methodologies? This is a very wonderful and timely question. So you will hear the term human-centered design, you'll hear design thinking, you'll hear user-centered design, you'll hear UX design or user experience design, service design, and all of those are kind of operant frameworks. And like within the design community and in the design literature, there's as many opinions about this question as there are practitioners. So I'm going to give you my take on the answer to that question, but it's not the final word. I don't think of there being very much difference between any of them. I think it's all about that philosophy and mindset supported by a process, supported by methods. But to me, they all boil down to what you're seeing on screen here and engage, having those cognitive reflexes and then following that up with action to engage authentically. As long as you're doing that, you could call that human-centered design. You could call it user-centered design. It wouldn't much matter. The one exception, I think, is that if you're doing something like designing like a digital product, some kind of public service portal or a website, well, that has a human-centered design element where you'd want to do a lot of the activities I've described, user research, co-creation, prototyping, user testing. But there are also, that's an area where there are a lot of aspects of design that are kind of known and they're not really up for debate anymore. So for example, it's almost universally true that people find websites more delightful when their navigation is shallow, meaning that they can get wherever they need to go in just 1 or 2 or maybe 3 clicks rather than 6 or 8 or 9. So virtually all successful digital products engage in that, create kind of shallow navigation. You don't really need to do user research to know that that's a good design principle. So that might be one exception where certain kinds of user-centered design aren't really the same kind of human-centered design. All right, coming back to the HCD, what is the connection between HCD and community-based participatory research and diversity, equity, and inclusion? Now, I'm not an expert in community-based participatory research, but this is my perspective, is that they're essentially the same thing. To community-based participatory research is a way of doing research with the people most affected by the program, whether it's education, workforce services, services delivered to tribal communities. It's engaging them directly at each step of the research process. So, helping to create the research questions, doing the research with them, interpreting the data, writing up the results. It's bringing those communities into that process and putting them at the center. And that's basically 100% the same as the goal for human-centered design. And that gets to that role of a human-centered designer as a facilitator rather than an expert that I talked about before. I think of human-centered design, though, as an extension of community-based participatory research, which often ends with research. Research is not action-oriented. It's not inherently problem-solving. It's answering questions. Human-centered design is interested in answering questions only for the purpose of solving a problem, creating something, doing something out in the community. So to me, the research part of community-based participatory research would be the first part of a design process that would then extend that research into the creation of a program, the improvement of a process, creation of a tool, or what have you, that is concrete in the world and making lives better in that way. And I think, and to tie that back to the diversity, equity, and inclusion, I think if you're doing HCD effectively, it's inherently diverse, and it's kind of a truism in design that to be effective, You have to have a diverse team, and that's diverse in every respect. I think for some problems, diversity of race, gender, and class may be especially important. Sometimes socioeconomic status might be important. Sometimes background and training diversity might be more important, depending on the nature of the problem you're working in. But it's just a truism in design that diverse teams are more effective, and there's a ton of research to support that. And going back to these methods on a previous slide, many of these methods are about creating team structures that allow the voices of everyone to emerge, on the theory that your most effective, creative, innovative solution is only going to emerge when everyone on that diverse team has a voice and is able to contribute authentically to the process. So for example, many of these methods, like dot voting, different types of how might we brainstorming, they rely on, they create anonymity within a team context, so that the most, the highest paid person in the room, or the loudest voice in the room, or the middle-aged white guy in the room doesn't just dominate. A lot of that is a lot of human-centered design techniques are set up for that explicit purpose. I believe there is just one more question in the queue, and I see we're coming up at time. I'm going to put the introductory slide on here with my email address again, in case anyone would like to continue the conversation. The question is there an introductory level toolkit with HCD methods that you'd recommend? There are a couple. I don't have them at hand, so please email me after the fact. You can also Google the Stanford Design School, often called the Stanford D School, little d dot school. They have what they call, I believe it's called the Design Bootleg, which is just a document of methods that is very good. It's probably about 80 pages long. There's also an entity called the Acumen Academy, which is a partnership between the nonprofit arm of the Acumen consulting firm and IDEO, which is a design consultancy. They run a free training course. I believe the next one starts up September 15th. It's online, it's all user driven, but it's quite good. If you follow up with me, I'll be happy to provide those links. That's it for questions in the queue, and we are at time. So I want to thank you all for coming out today, and I hope to hear from you soon. Happy designing.